Hello everyone, my name is Kenzie and I am the Clinical Education Coordinator for our local ultrasound program. I've been a part of this program going on 4 years and I have been in the ultrasound field for about 6. So today I want to express the importance of proper ergonomics when scanning and talk about some ways that we can improve our ergonomics and make things easier on our body so that we can have a long, successful career in this field. It's so important that we try to prevent and save ourselves as much pain and suffering as we can, especially knowing that many sonographers who have been in this field for a long time experience pain and injuries as a result of scanning patients day after day. So you may be asking what ergonomics even is. Well, ergonomics is applying the proper posture, making the right moves, or even just utilizing the design of the equipment to make things easier on us and prevent strain on our bodies long term. So any of these things or whatever other factor it might be that you're utilizing can make our job more efficient and safe for our bodies, and it's going to make us able to continue our career for a long term. Most of us go into our careers expecting to work in that field for many, many years. So we have to take care of ourselves early and make sure that we make the proper adjustments to make sure that happens. So before we start talking about ways to improve our ergonomics, I want to discuss why it is so important to think about this and why you should be concerned about it early on in your career before having these injuries or pain instead of waiting until after you've experienced an injury due to the repetitive scanning that we do. Anything that we can do to prevent these injuries is going to be huge. So the Journal of Diagnostic Medical Sonography gathered data from around 3,000 registered sonographers, and they found that 80 to 90% of them were scanning in pain and discomfort. 80 to 90%. That is a pretty large percentage of sonographers in pain every day. Some of which will have to end up calling off work due to the pain, or even taking extended periods of time off to possibly have corrective surgeries. So we really want to try to prevent that. Most of this pain was reported to be in the neck, shoulders, and the hand and wrists, even in the fingers. So if you think about it, when a sonographer is scanning, they're putting a lot of pressure and movement on their wrist and fingers while they're manipulating the probe and camera. So we're doing a lot of this, moving back and forth. And then their neck and their shoulders while they're applying pressure to their patient during each exam. So think about when you're using this kind of movement to push down on your patient. Long term, that's going to start to cause some injury to your shoulder and even in your neck. So some big things that can influence poor ergonomics and lead to these injuries are poor posture while scanning, doing those repetitive movements over and over, having a bad grip on our probe or our camera, or using too much force. So think about when we're writing for a long time, when you have a paper that you have to write and you've been using a pencil or a pen and you've been writing for a really long time, our hand starts to cramp up. So it's those same fine movements that a sonographer is doing day after day without proper ergonomics can lead to pain and injuries that could potentially put them out of work for extended periods of time, and nobody wants that. So how can we prevent all of these issues that a typical sonographer sees? Well, we can start by adjusting our workplace to work better for us, the worker, and the limitations that we might have. One of the first things we can do as a sonographer when we start an exam is to adjust our patient's bed. We can move that bed up and down. We can adjust our machine. We can adjust our chairs to the appropriate spot. Any of those things are going to help us. So the International Journal of Industrial Ergonomics suggests that when an ultrasound technologist is scanning, their arm abduction should be less than 30 degrees. So what that means is when we have our arm out like this to scan our patient, who's usually lying on our bed, this angle right here should be less than 30 degrees. So greater than 30 degrees, less than 30 degrees. So we want that elbow tucked in as close as possible to us as we can. So we don't want to have our arm held out any further than that for too long, or we can cause some serious injuries to our shoulders. Can you imagine holding your arm out in a position such as this for 30 minutes or maybe even more without relaxing it? Over time, that's really going to start to hurt. So in order to keep that angle less than 30, it's important that we position our patient's bed so that the patient is slightly lower than where our arm will be resting at in our scanning position. So slightly lower than where we'll be. The International Journal of Industrial Ergonomics states that in order for our arm to be in that neutral position that's natural for us to create that least amount of harm, our arm should be positioned so that our forearm here is parallel with the floor beneath us. So we can do this by either lowering our patient's bed, or we can raise our chair so that we're at a comfortable position that allows our arm to rest at that position. The next thing that we want to do is make sure that the patient is as close to us on the bed as possible so that we're not stretching across the bed to reach them. So imagine your patient is way over on the side of the bed. You're having to lean over and stretch to get them. That's also going to hurt our backs because that's poor posture. So once our chair and the patient's bed and the patient are appropriately positioned, next things we should do is check to see how far away our machine is. So just as we don't want to be reaching to scan our patient, we also don't want to be stretching our other arm away from us to adjust our machine settings either, thus putting us in this back and forth battle between our patient and our machine. That's going to put a lot of strain on our bodies, a lot of strain on our arms, and things like that. So think about when you're typing on your computer. You want to be typing pretty close to your computer. You're not going to be really far away stretching to get to it. So the same distance applies when we're talking about our ultrasound machine so that you can keep your hands as close to your body as possible. So moral of the story here, we're trying to keep everything as close to us as possible so that we're not stretching further away than we need to be. So not only is it going to be important to keep our machine close as possible for typing purposes, but we also want to be able to set and adjust our monitor or the screen that we're looking at, that ultrasound screen that we're so used to seeing, to an appropriate height so we're not straining our neck by looking too far up or too far down at our screen. Ideally, our neck should be flexed at about a 15 to 20 degrees in order to prevent discomfort over long periods of time. So an average ultrasound exam is going to last about 20 to 30 minutes, sometimes even upwards of an hour depending on what you're scanning. And when you add up all that time over the course of a day, and then the course of a week, and even into a year, it can really wear on our bodies if you're not practicing proper ergonomics each and every time that you scan. When it comes to pain and injury to the wrist and the fingers, this is an area of ergonomics that can take a little more practice to master. It's not as easy as just moving our patient closer to us or adjusting our chair, things like that. Oftentimes, injuries to the wrist and the finger occur to poor grip or poor posture or pressure when holding that probe or that camera that we use. So an optimal grip on the probe is taught over time with practice. As a new sonographer continues to scan, they start to realize the techniques and the pressures that they need to manipulate those probes. For movements such as rotating or rocking our probe, it's important that we try to utilize movements more in our fingers instead of turning our wrists. I know when I work with new students, a lot of times I see what I like to call the death grip on the probe. So they'll be squeezing that probe really, really, really tight, and they don't release that pressure the whole time they're scanning. So this pressure would be similar to if we made a clenched fist and we squeezed it really tight and we held that for a really long time. Eventually, that's going to cause a lot of pain in our hands. So I'm always telling students to lighten up their grip to a more neutral, natural state and relieve some of that pressure that they have. But this takes time to realize and become comfortable with, so it's important that we address that habit early on in our students, in sonographers early on in their career, so that doesn't continue long term. You don't want to make a habit out of it. So having relaxed pressure and proper grip will help prevent some of those wrist and finger issues. But in addition Additional techniques that can be utilized to help with pain is taking micro breaks during exams. So just a tiny little break where you lift that probe off of the patient to reduce some of that strain on your neck and your shoulders and your hand for just even a quick minute is going to help relieve some of that pressure for long term. There's also different techniques that we can use on the machine, or different settings that we can use on the machine that can be helpful when penetrating in better cases of like an obese patient. So you really want to learn those different settings on your machine so that you can utilize those and you wouldn't have to push as hard. So you can either push harder on your patient to try to see, or you can utilize settings on your machine that are going to help you see better. And so then you don't have to put that pressure on your patient, and you don't have to put that pressure on yourself either. So to help aid in ergonomics and keeping our body healthy and pain-free, it's also very beneficial that we start to do routine stretches. So as with any repetitive movement that we might do, it's important to practice stretching those muscles daily if possible, so that our muscles can remain flexible and loose. I have a couple different stretches that I was taught from a physical therapist that I know. I have her come in and teach my class some different stretches and things that they can do so that they can start incorporating those into their daily routines and hopefully, prevent some of these injuries that we so often see. So I have a couple stretches that I do. I try to integrate into my daily routine. I try to keep them simple, quick things that I can do, just a stretch here and there during our breaks, in between patients, any sort of quick thing that I can do and get done so that I am still stretching over the day. So the first stretch that I like to do is for my neck. So while keeping a straight posture, you can lean your ear towards your shoulder, and you're going to be stretching that opposite side of the neck. So I hold that position for about 15 seconds and then switch to the other side and stretch the other side of our neck. You can do cervical flexions or extensions. So either looking straight up towards the ceiling for a little bit and looking straight down. That's going to be flexing and extending our neck muscles there. For our shoulders, something we can do to help with the shoulder pain that we might have is shoulder rolls, which is just an easy stretch that you can do while you're waiting on your next patient. You just keep your arms down to your side and you just roll your shoulders back. So I usually do about 10 at a time. And again, a couple times throughout the day, just to keep those muscles loose while I'm scanning throughout the day. Another stretch that you can do for your shoulders is called a lat stretch. It's where you grasp your wrist with the opposite hand and you just stretch like this to one side or the other. And it's just going to stretch those muscles through here so that we're trying to prevent any injuries that we might have to those. Hold for, again, about 15 seconds, and then you can switch to the other side. For the wrist, I like to do wrist flexions and extensions. So by keeping your elbow straight, you can use the opposite hand and pull back to flex that wrist, help with those muscles there. Or you can pull back this way and extend your wrist this way. Again, just moving those muscles so that we're keeping those nice and loose. And then as far as fingers go, the last stretch that I really like to do is just finger extensions. You just make a fist and you extend your fingers out. Do that a few times, just working all those muscles and joints in your fingers. That's, again, going to help with those long periods of scanning that we do. So those are just a few of my favorite stretches, but I highly encourage you to find some stretches that work well for you, and even focus around areas of concerns that you have with what you're doing, things that bother you. If it's your shoulder, your neck, focus on those stretches and do a little bit more of those so that you can help with those. So let's recap what we've learned today. We know that many sonographers struggle with neck, arm, and hand pain associated with scanning patients every day. So in order to cut down on and hopefully prevent some of these injuries, it's extremely important to practice proper ergonomics. Proper ergonomics in ultrasound includes adjusting our chair and our patient's bed to the appropriate level so our arm is not abducted any more than that 30-degree angle. You can bring your machine close as possible to prevent reaching for the keyboard. And then adjust your monitors so that it's at the appropriate height and you're not straining your neck to look at it. To help relieve stress on our wrists and fingers, it's important to learn proper grip on the probe and keep a light pressure while we're scanning. Other ways to prevent strain on our bodies is to take micro breaks during scanning, to utilize machine settings that reduce the amount of pushing that we need for our patients, and to perform routine stretches to keep our muscles loose. So I hope that you've all learned some new advice for keeping your body safe, and you can integrate some of these tips into your own career so that you can keep going for many, many years. Okay, well, thank you.